A recent article in the LA Times reported many people have died from taking opioids. Some due to opioid abuse, while others have died while taking their medicines as prescribed. There are over 15,000 opioid-related deaths per year. Did you know that there are more prescription drug-related deaths than there are car accident fatalities?
The escalating problem of prescription drug abuse has cast a legitimate spotlight on opioids because of the many dangers they can cause. Extended use can lead to dependence, addiction, and increased tolerance of the pain medication itself, therefore minimizing the benefits of pain relief.
We go to great lengths to protect our patients from the significant risks that are associated with opioid therapy and narcotic medications. We stringently follow DEA recommendations regarding prescribing opioid medications.
While we understand that opioid prescriptions play an important role within pain management and oftentimes prove to be beneficial for a lot of our patients, we pride ourselves on being aligned with the supporting research and believe in low to moderate dose opioid therapy.
We typically do not prescribe high doses of opioid medications, as research continues to show that this regimen has much greater risk for patients with fewer long-term benefits as compared to lower doses.
Let's take a look at the numbers. On a monthly basis, in our patient population, we reduce opioid medications on 69% of the patients that we meet. 52% of these patients come completely off opioids.
In addition, the average dose of the opioids we write is 60 milligrams of morphine equivalent. So not only do we effectively reduce the number of patients on opioids, but we also keep our average doses low. Our physicians follow a 12-step opioid protocol, which includes the following compliance checklists for long-term opioid therapy.
First, we assess the patient's pain on a scale from 1 to 10. Second, we clearly document the rationale for opioid use. We want to make sure the use of opioid therapy makes sense for this patient. Third, we clearly document the beneficial clinical response to opioid use. In this instance, we want to make sure the patient will have a decrease in pain and an increase in function.
Next, we establish goals with the opioid treatment and review these goals with the patient. By establishing goals, we can see marked improvement and progress. We always keep a current and updated medication list and document any substance abuse and social history problems. Then we conduct a physical examination of the painful area.
We also have a process in place to check the patient's pharmacy history to make sure they're not getting similar medications from other doctors. We also look at urine drug screens and make sure the patient's actually taking the medication we're prescribing. Finally, we make sure the patient has signed an opioid agreement and contract within the last 6 months. Part of this process is a good assessment of the risk and benefit of the medication and making sure that our patients understand the significant risks of opioids.
The final thing to remember is that patients need to understand the great potential risk of opioids. When patients are on these medications, they need to take their medications as prescribed and need to be closely monitored. We need to increase public awareness on the risk involved with opioid usage. It is also important to understand that there are many different therapies available that can help those in pain find the pain relief that they are searching for.
For more information about this topic and others, check out our website at nevadapain.com. We change lives here.